Hepatitis D, HDV. Hepatitis D, HDV, is a viral infection that causes liver inflammation and damage. Inflammation is swelling that occurs when tissues of the body become injured or infected. Inflammation can damage organs. Viruses invade normal cells in your body. Also, many viruses cause infections that can spread from person to person. Meanwhile, the hepatitis D virus is unusual because it can only infect you when you also have a hepatitis B virus infection. In this way, HDV is a double infection. In particular, you can protect yourself from HDV by protecting yourself from hepatitis B by getting the hepatitis B vaccine. HDV spreads the same way that hepatitis B spreads, through contact with an infected person's blood or other body fluids. The hepatitis D virus can cause an acute or chronic infection, or both. Causes of hepatitis D. The hepatitis D virus causes hepatitis D. The HDV virus spreads through contact with an infected person's blood or other body fluids. Specifically, getting an accidental stick with a needle that was used on an infected person. Sharing drug needles or other drug materials with an infected person. Having unprotected sex with an infected person. The hepatitis D virus rarely spreads from mother to child during birth. You can't get HDV from shaking hands or holding hands with an infected person, being coughed on or sneezed on by an infected person, sharing spoons, forks, and other eating utensils, drinking water or eating food, sitting next to an infected person, hugging an infected person. Symptoms of hepatitis D. Most people with acute HDV have symptoms, such as pain over the liver, in the upper part of the abdomen, feeling tired, nausea and vomiting, poor appetite, darkening of the color of urine, lightening of the color of stool, yellowish tint to the whites of the eyes and skin, called jaundice. In contrast, most people with chronic HDV have few symptoms, until complications develop, which could be several years after they were infected. Some symptoms of cirrhosis include jaundice, weakness and feeling tired, swelling of the abdomen, weight loss, swelling of the ankles, called edema, itching skin. Types of hepatitis D. Acute HDV. Acute hepatitis D is a short-term infection. The symptoms of acute HDV are the same as the symptoms of any type of hepatitis and are often more severe. Sometimes your body is able to fight off the infection and the virus goes away. Chronic HDV. Chronic HDV is a long-lasting infection. It occurs when your body is not able to fight off the virus and the virus does not go away. People who have chronic hepatitis B and D develop complications more often and more quickly than people who have chronic hepatitis B alone. Risk factors of hepatitis D. Hepatitis D infection occurs only in people who have HBV. People are more likely to have HDV in addition to hepatitis B when they are injection drug users, have lived with or had sex with someone who has hepatitis D, are from an area of the world where HDV is more common. Complications of hepatitis D. Complications of acute hepatitis D. In rare cases, acute HDV can lead to acute liver failure, a condition in which the liver fails suddenly. Although acute liver failure is uncommon, hepatitis D and B infections are more likely to lead to acute liver failure than hepatitis B infection alone. Complications of chronic hepatitis D. Chronic HDV may lead to cirrhosis, liver failure, and liver cancer. People who have chronic hepatitis B and D are more likely to develop these complications than people who have chronic hepatitis B alone. Early diagnosis and treatment of chronic hepatitis B and D can lower your chances of developing serious health problems. Diagnosis of hepatitis D. Doctors diagnose HDV based on your medical history, a physical exam, and blood tests. If you have HDV, your doctor may perform tests to check your liver. Medical history. Your doctor will ask about your symptoms and about factors that may make you more likely to get hepatitis D. Physical exam. During a physical exam, your doctor will check for signs of liver damage such as Changes in skin color. Swelling in your lower legs, feet, or ankles. Tenderness or swelling in your abdomen. Doctors use blood tests to diagnose HDV. Your doctor may order tests to check for liver damage. Find out how much liver damage you have, or rule out other causes of liver disease. Blood test. Your doctor may order one or more blood tests to diagnose hepatitis D. A healthcare professional will take a blood sample from you and send the sample to a lab. Then, a healthcare professional collecting blood from a patient. Your doctor may order one or more blood tests to diagnose HDV. Additional tests. If you have chronic HDV and hepatitis B, you could have liver damage. Your doctor may recommend tests to find out whether you have liver damage. To greater than or how much liver damage you have. To greater than or to rule out other causes of liver disease. These tests may include blood tests, elastography, a special ultrasound that measures the stiffness of your liver, a liver biopsy, in which a doctor uses a needle to take a small piece of tissue from your liver. Then, a pathologist will examine the tissue under a microscope to look for signs of damage or disease. Doctors typically use liver biopsy only if other tests don't provide enough information about the liver damage or disease. So, talk with your doctor about which tests are best for you. Treatment for hepatitis D. Doctors may treat chronic hepatitis D with medicines called interferons, such as peginterferon alpha-2A, Pegasus. Researchers are studying new treatments for HDV. In addition, medicines for hepatitis B may be needed. These are usually medicines taken once daily by mouth. Treat the complications of hepatitis D. When chronic hepatitis D leads to cirrhosis, you should see a doctor who specializes in liver diseases. Doctors can treat health problems related to cirrhosis with medicines, surgery, and other medical procedures. When you have cirrhosis, you have a greater chance of developing liver cancer. Your doctor may order an ultrasound or other type of imaging test to check for liver cancer. When acute hepatitis D leads to acute liver failure, or if chronic hepatitis D leads to liver failure or liver cancer, you may need a liver transplant. Thank you. I hope you are always happy and healthy. Thanks for watching. Don't forget to subscribe to the channel to receive useful information.